Hello, I'm Nicole Bixler, and I'm proud to serve as your president of the American College of Osteopathic Family Physicians. And thank you for the opportunity to address you, the most important part of our organization, our members.
Hi, I'm Bob Moore, your Executive Director. As we gratefully look at 2020 in the rearview mirror, I just want to thank you for your perseverance in what was an unprecedented year. I know that you sacrificed many things for your families and your communities to be a frontline provider, and we couldn't get through this pandemic without you and your role in your communities. Looking ahead, I want to let you know that your board leadership and your staff are committed to you and the profession and allowing you to be the best that you can be.
As I look forward to 2021, there are many priorities that I would like to focus upon, but most of them all lead back to the same thing: having a focus on you, our member, and your needs. How do we do that? Well, we look on our cornerstones of our organization: advocacy, education, and leadership. I hope that we can continue our good work in the first half of the year with our virtual CME offerings, and hopefully in the second half of the year be able to offer those live and in person, but most likely with continuing virtual options. We hope to be able to provide opportunities for our students and residents to become more engaged in our profession. And we look forward to continuing our advocacy efforts to provide you, the provider of family care, to our patients, the tools that are needed to be able to do that successfully. I wanted to take the opportunity to tell you about a few initiatives that are exciting for 2021. First and foremost, our Task Force on Racism and Health, which was started in 2020 after the events that have taken place in our country. It was long overdue and much needed, and I am very excited about the enthusiasm of the 30+ volunteers that have been able to convene and discuss what is needed for the ACOFP to address. I look forward to the work that can be done in governance, community outreach, and advocacy in these areas. And I'm particularly excited about the Diversity, Equity, and Inclusion Award that will be given this year for the first time.
I'm also looking forward to our ability to implement recommendations from the Task Force on Convention Innovation, which provided us with a ton of recommendations on ways to develop and deliver content in new and different ways to you as members. And we'll start that in March with our virtual annual convention, organizing our content in new and different ways and trying a new platform. And then in July, when we offer Intensive Osteopathic Update in a hybrid model, meaning both in person and online. Hopefully you're aware of our foundation's initial certification fund, which has already raised $1.3 million to help support the cognitive and practical exam for residents. If you're so inclined, we would love additional contributors to help support this worthy cause, but equally important, we would really appreciate your help spreading the word to residents and residency programs about this wonderful resource. We also have support for our state societies that's new and different. We're offering quarterly webinars to help provide support at the state level. And last but not least, we have some great opportunities to work with other healthcare associations, and they're looking to work with us to create new programs and resources. And where possible, we're looking to provide free CME to help support your professional development.
I've been asked what I look forward to most for the ACOFP in 2021, and that's pretty simple. It boils down to one thing: seeing all of you in person. Boy, how we've missed the osteopathic camaraderie, collegiality, networking, hugs, and just being able to be around one another in what we call the family of ACOFP. Hopefully by the end of 2021, we will have that opportunity to meet in person yet again. Most of all, I would like to thank you for doing all that you, DO, do. Not only every day in providing care to your patients and your communities, but what you do to represent what is good about osteopathic family medicine, and hope that you are able to continue your good works during this most trying time. There is absolutely nothing that ever prepared any of us for the events that have taken place thus far in 2020. It certainly is unprecedented, but I believe there is no other profession that can rise to the challenge and do what is needed to take care of one another. I am humbled to be representing your organization, the American College of Osteopathic Family Physicians, and I cannot thank you enough for all that you do. I think 2021 has great things in store, and I'm really excited to see what we can do.
Here's to a very successful and healthy 2021.